Hi, I'm Dr. Jessica Kulik at the Naderi Center. I'm a facial plastic surgeon here, and basically the majority of my practice is focused on facial rejuvenation. One of the key procedures that I do in a lot of patients is a facelift surgery. One of the things that I think is most important about having a great result after a facelift surgery is your post-operative care. The biggest part of facelift surgery is the downtime of swelling and bruising, and one of the things that I like to utilize to help reduce some of the swelling and bruising is this AquaCool mask. The AquaCool mask is a great tool to help with swelling and bruising because it's a mask that can be worn the first couple days after surgery that allows cool water to cycle through it and give some relief for the swelling and bruising without having to use something as cold as ice. Ice can be very traumatic to the tissue, especially after a facelift, and almost too cold and maybe inhibit facial healing and interfere with the skin as well. So I really like this because you can really adjust the temperature so that it's cool and helps with the swelling and bruising, but doesn't have that extreme cold as ice. Also, for comfort, ice isn't that comfortable. This is nice and cool, and you can actually adjust the temperature of the coolness of how cool you can tolerate it that's comfortable, but still giving you some nice improvements with the swelling and the bruising. So after I see a facelift patient, I take off their dressing from surgery, and then I use this AquaCool mask in their first post-operative day. The mask, you can see it has the lining on the inside where the water will flow through it. This is the plastic lining. It has the ports on the outside where it attaches to the machine right here, and those ports will go into the machine to attach to allow the water to cycle through it. Those can be released with a button. Sometimes the orientation of the mask, which I always review at our post-operative appointment, can be a bit confusing, so I'm just going to demonstrate how the AquaCool mask is put on. So to first orient the AquaCool mask, the best way is to orient this black mesh material downward so that that's going to be on the neck. This curvature is going to be under the chin, and these holes actually go around the ear. So you put that around the neck, like so. Find the ears to bring up around the ear holes, and then secure it with the Velcro. Then I like to put the straps to cross under the hair, bringing it around to Velcro anywhere on the mask. And then these pieces can be bent towards the face. And then we plug it in, and then you can adjust it and relax in whatever room you want of the house. So the way we do the AquaCool mask system at the Naderi Center is we take care of all the details. We have the machine actually delivered to your house. You get that usually the day or two before surgery. I put on the mask during your post-operative appointment, and then after around 3 days, usually when the height of the swelling is really gone down already, you don't necessarily need to use the AquaCool mask anymore. So usually most patients will return the machine after around 3 days by simply calling the FedEx number that we give you. You call the number, the FedEx picks up the machine, and the mask can just be disposed of.